today we are having an interview with Dr. Mahmoud Ghannoum. He is the director of the core and the director of the Microbiome Core at Case Western Reserve University, as well as professor, and he's the founder and scientific director of Biohm. He recently was the first author on a publication entitled A Microbiome-Driven Approach to Combating Depression During the COVID-19 Pandemic, published in Frontiers in Nutrition. So thank you for talking with us today.
It's my pleasure.
The first question is just a little bit of background about you, because this field is so new, microbiome research is so new. How did you get into studying this? And like, is this the main focus of your research lab?
Yeah, well, I started, the microbiome. I started to go to, usually to scientific conferences and people start talking about the microbiome. And usually, a lot of the time when these things start, people talk about bacteria. Really, as a person who's been working in the fungal world or in the mycology world, I thought, no, we really need to also consider fungi as well. And that's where, and that really was the basis for that. Is I always knew if people take antibiotics by killing the bacteria, guess what happens? Like the good bacteria and the bad bacteria, when you kill them, you have overgrowth of fungus. And that told me that there is a relationship between the two and that these organisms live together, these two communities, the fungal community and the bacterial community. And that's where I started in 2010 writing articles saying, look, we really need to look at the total microbiome, not just the bacteria. And, ever since, we looked at different diseases, and the good news is that a lot of people start to realize that you really need to look at both community, not one or the other, but because these two live together, in addition with viruses that can affect our health, both disease and conditions.
Yeah, so you transitioned from fungal research to microbiome research, and then, so how did you come onto the connection between the gut and the brain in something like depression, which this paper is about?
Yeah, well, of course, working in the microbiome area, you'll start to realize that, when you have microorganisms in our gut, we did not think that there is a connection to our, for example, neurodegenerative diseases or like Alzheimer or autism and this sort of thing. And what happened, I start, of course, reading into this and doing experiments and the studies on different people, and we realized, we and others, not just we, because as you know, there is a really explosion of studies in this field. We started to figure out that there is communication between our gut and the brain, and that's what we call gut-brain axis. For a long time, we used to think only our brain tells us what to do. Right. In fact, now we know it's bidirectional communication. In other words, the brain, when there is something there, can talk to our gut, but also in the gut, we produce a lot of these neurotransmitters, for example, like serotonin. 90% of serotonin are produced in the gut, which can go into the bloodstream and start to tell our brain about things. So that's why it is bidirectional, two ways, up and down.
Okay, so within Case, are there a lot of researchers that also work on the microbiome, or are you kind of like out on an island?
I think within Case now, with the concept that this is going on, we have people who are working on the vaginal microbiome, for example, reproductive system. Also, we are partnering with a lot of people in the cancer center. We are starting to look at different types of cancers and looking like, for example, we look at tongue cancer and we published work on that, and we showed that there is a differences in the microbiome with people with tongue cancer and without, in both bacteria and fungus, in fact. And we have other people, we're looking at really different types of cancers, head and neck cancer, also other people looking at the pancreatic cancer. So we are starting to do a lot of studies in this area. And the nice thing about the integrated microbiome core that I direct it is now identified as a cancer resource sharing core. So people now from different parts of the institutions, not just at university hospital case, but also other, like Cleveland Clinic, for example, we started working together on different types of cancer, you know. And really we have an exciting study, which is gonna start soon, is looking at the effect of the Biohm probiotic, which we designed on breast cancer. So that will be exciting. So yes, there is a lot of activities in this area.
Yeah, and I feel like even if there aren't like microbiome people, it's like the connection between all the different areas of science is very important for something like this. Otherwise, like the gut-brain axis would have never like been.
Absolutely.
Yeah.
You know, you are absolutely right. Like I wanted to work, now we are working on autism. You know, we did a study, we found that there is some imbalance in autistic kids. But now to try to understand more, I start working with a neuroscience department because, you know, which is, it's like you are involved in these things. So in this neuroscience department, they have animal models of autism, okay? Right. So it's very important. These days, science, as you alluded to, is really a group work, a teamwork, more so than you are in your own lab and you discover everything. It's this is gone. This is the old model. Now we are a team science work. It should be.
Yeah, which I mean, I think is a good push forward. So looking more narrowly into this paper, what was the driving force of this paper, and why did you decide to do this project and look into this depression in COVID-19 and the microbiome?
I mean, really, the driving force was we entered into COVID pandemic, which changed our life. And then when I start looking deeper into it, within even 1 month of COVID pandemic, we started to see prescription of anti-anxiety medication, antidepressant, and as well as anti-insomnia drugs really increased tremendously, you know? And also a lot of people, like nearly, believe it or not, during this month, nearly 60% of people start to report that they have some mental health issues, okay? And then the last thing, you know, a lot of people, like they need help, they call to these helplines, and we started to see nearly 900% increase in the call volume to these help center. So this made me think, you know, I really would like to do something to help these people because I know with the COVID also, there was a study which connected COVID with the microbiome. Yeah. And with that in mind, I said, okay, what can we do about that? And that's where I started to put the paper together.
Yeah, so do you think that these type of interventions that you laid out in there, do you think that they're helpful specifically in cases like this where it's very acute stress and it's like rapid onset, or do you think that they're equally helpful with all types of depression, even long-term depression?
I really think if you believe that there is a relationship between the depression or stress, which we know, is there a relationship between them? And we know there is a connection between the microbiome and depression. But COVID, basically what it did, it intensified this observation. So to me, the recommendation which we came out with will help a person even without COVID. If you are depressed, there are ways, holistic approaches which you can follow, which can help you. It's just COVID brought it to the focus, you know? That's the difference.
Yeah. Do you think that the medical field, as like research like this has come about, is quick to embrace these type of lifestyle changes as like telling their patients to do something like this, not just along with obviously clinical drugs and stuff like that?
Sure. You know, this is really very, very important question. The problem we are having is that a lot of the healthcare providers don't understand the microbiome, you know, and they don't understand how it's related. And that's why, so that's one thing which is an impediment. We really need to educate healthcare providers so that they understand the connections, and they will be able then to start thinking of new ways. Like once you know that there is establishment between, for example, depression and the microbiome, then you need, as a healthcare provider, you need to start to think of new holistic approaches to really help your patients, okay? The problem is we need to educate healthcare providers. And I can tell you the good news is I really developed some CE, continued education modules, so that I can help clinicians and healthcare providers in general to understand this, because once they understand it, they start appreciating. It is not, as you said, it is not just the medications and therapies, but also we can have additional tools which can rebalance the microbiome, and based on this, hopefully help their patients in reducing the depression and making them feel much better.
Yeah, I mean, I didn't even think about the importance of continuing education, but like this entire field has developed in sometimes like people's career after medical school, you know? So like that is pretty a very important thing to continue your entire career. Okay, so in this, in your study, the paper specifically, it highlights the connection between many different fields. Do you see that this overlap is not only the next phase of research, which we discussed, but do you think that this overlap will also be the next phase of medicine and treatment?
No doubt about it. I think once we understand and appreciate the role of the microbiome and how having a balanced microbiome is going to help you in general, because look, the studies already shown that. Like there are studies, for example, when they started to do fecal microbiome transplant, they showed that it has benefits, you know, so it is there. And because of this, I think this, if we understand this and we start applying these holistic approaches, we will be able to help patients to go into the prevention of disease rather than treatment. Okay? So if you adopt a good diet, you exercise, like lifestyle, for example, in general, you are gonna play some way in improving your health. It doesn't mean that this is the only way. It's always very important to know that we really need to talk to our physician. We really need to talk to our healthcare providers, because there could be other reasons that really need to be addressed. So to me, I will not just advocate this holistic approach by itself. It's like I talked before, you need to think of bacteria and fungus. Here, I also think you need to look about what traditional approaches, let's combine an additional tool to help our patients.
Yeah, so we've kind of alluded to it, but I realized we didn't go over it. Can you describe some of these holistic changes that people can make? You talked about them directly in your paper, but can you describe them for everyone who's like watching this and hasn't read the paper?
Yeah, sure. I mean, basically, it's three different approaches. What we did in the paper, we reviewed the literature, okay? And we looked at how can we change the microbiome, okay? One of the approaches is diet. This is well established that this is the situation. In fact, I published a book called Total Gut Balance, where it talks about the microbiome, provide the scientific background, and then we provide what type of food and what type of diet you should follow. And we even provided recipes for that. So to me, if you think about it, diet is very, very important. And we always say, look, to reduce depression, for example, since we are talking about that, it will be nice to have a food that is mostly whole food. You need to have for example, every day, if you can, you need to take some good oils, such as coconut oil, extra virgin olive oil, like in your salad, you know. Try to use some resistant starch, okay? Bananas, oat, from corn, legume, like beans, as well as potatoes have it. It's very important to eat fruits and vegetables. You know, for example, at lunchtime nowadays, I eat only fruit and vegetables, you know, because I think these have the right type of protein we need to have. The other thing which I recommend to people, look, why don't you eat some nuts? Like, for example, pistachios. A lot of the time when I want to take snack at 10 o'clock in the morning, you know, after doing all my emails and whatever, I love to take pistachios. And studies have shown it can really improve your microbiome. Okay, so that's first is the diet. There are some food which I also recommend that people should avoid, you know, like, for example, no added sugar or sweeteners, because these have been shown to really affect the microbiome. And sugar in particular will increase the fungus, you know, the candida, which is one, if it overgrows, it causes problem, loves sugar. Okay, so no added sugar, no processed cured meat, no processed packaged food, you know, oils apart from the ones I talked about, not a good idea. So this is like in general what's the diet could be. Okay, that's what we recommend. But then we looked at other stuff. Will probiotic, for example, help in rebalancing the gut? And in the article, we showed clearly that there is a relationship between probiotic and the microbiome. And there are studies which shows that really taking the right probiotic could alleviate stress, okay? And we also, in the paper, we talk about how they can do that. How can these probiotic strains help us, in other words? And, you know, if you think about it, these probiotic strains, they can support the beneficial microbes, because we have beneficial microbes in our gut, as well as sometimes we have overgrowth of the pathogens, or those that can really cause disease, okay? These beneficial organisms that are present in the probiotic, they can also produce what we call small chain, short chain fatty acids, you know, small molecules, metabolites, okay? And these metabolites, they play very important role, not only in our gut, but also when they are secreted into our bloodstream, they can go to the brain and affect our brain. You know what I mean? Like, so these are some evidence that the probiotic really can help, okay? And then the last part we talked about in our article is about, can we adopt a lifestyle that's gonna help us, okay? And what do I mean by lifestyle? There are three things in particular I like to talk about, you know? It's exercise, sleep, and stress reduction, you know? And really, it's very, very important we follow that. Like, for example, exercise. And when I talk about exercise, I'm not talking to be killing yourself. Moderation, you know, everything in moderation. Take walks, try to half an hour a day if you can, you know, and that definitely have been shown to have beneficial effect on the microbiome, you know. Like, for example, studies showed that there is an exercise can increase the diversity of the microbes in your gut. In other words, microbes that live in our body, we want them to be diverse. In other words, the more we have, the higher level we have of diverse organisms, the better. It's like a society. I think, my point of view, our society will do much better if it is diverse, because we help each other. Okay. The same, these organisms have been shown to be affected by exercise, where they try to maintain the balance between the beneficial organisms and the pathogen. Okay. Another important effect of the exercise, it showed that it can reduce inflammatory conditions, you know. And remember, I mentioned serotonin, for example, which is really, it gives you a feeling of well-being, of happiness, and it is really produced in the gut. So by exercise, when you exercise, you have an increase in this feel-good endorphin, okay? So this is exercise. We we talked about the other thing is sleep. Sleep is very critical, which is not really new findings. You know, when you sleep well, the second day you are much better. But in Italy, they did a study of COVID-19 lockdown. And what they found, people, because of the lockdown, 23% of them reported depression, you know, and more than 40 reported sleep disturbance.
Mm-hmm.
And we know, as I mentioned, if you sleep well, it has a direct impact on our microbiome, you know, especially with respect to the balance and diversity, which we talked about. Okay. That's why I recommend sleep maybe 7 to 8 hours a day.
Yeah.
And finally, the last lifestyle is stress. It's very important that we try to reduce our stress. And as you know, this is easier said than done, especially these days with the COVID, with all, you know, especially with women taking care of their kids, with job and this sort. It's really, really stressful life, you know. So we need to try to do things that can help us, okay? Try to take maybe even 15 minutes a day, just meditate or do yoga. I always talk about yoga. I think yoga is a great thing to do.
Yeah.
I never did yoga before, you know, and I come from the Middle East. I'm from Lebanon. I never thought of yoga. And now I do yoga, especially at weekends. I used to go before COVID. Now I do it at home. You know, it's really great. It relaxes you. Mm-hmm. So that's why I tell the men audience when I speak in meetings, I am talking to you as males. Women are smarter than us. Go and start doing yoga, you know, and it really helps them. It reduces the stress a little bit. And when you put it all together, really this holistic approach can help. I hope.
And I think one of the few good things that came out of the pandemic is like signaling or telling people to like really take care of their mental health was something that was really at the forefront and like became part of the mainstream. Because I know I saw it a lot, like go take walks, get outside of your house, like do anything. So I think that if that continued, that would be, you know, a great thing for everyone to keep in their lifestyle.
It really is very important. It's really very important. Like for me, I now wake up in the morning, I go exercise half an hour, you know, and it's really fantastic. And if I don't do it, you know, the other day I was traveling to give a talk in Wisconsin about the microbiome to healthcare providers. And, you know, because of the travel, I couldn't, I wasn't near my elliptical or bike, so I didn't exercise. And you feel not great. So I come home and the second day, I start doing it and it was hard. So I said, oh my God, I should not miss a day.
Yeah, I mean, and people don't think about that because it's like, it's hard to get into at the beginning, but it's also hard to get out of. It's like a cycle. So yeah, that is true. I was going to ask you if you actually take up these things, but it definitely sounds like you have done all of these in your life.
No, I do, honestly. And you know, with food also, I changed the type of food, what I eat. But I still enjoy, you know, food, but I basically structure it more. Like in the morning, I try to eat oatmeal and this sort of thing. I add a little bit of berries and this stuff. I take nuts, as I mentioned, pistachio or mixed nuts, for example. At lunchtime, I eat really mainly vegetables and some banana and apple, you know. And in the evening, we eat, I love salmon. I love, you know, roasted vegetables, especially these days, you know, with the winter coming, you know, asparagus, broccoli, and it's really, it's good. And you feel good, you know, you feel good.
Yeah, there definitely is a noticeable change. So my final question is, what is the thing that you are most excited about emerging in this field?
I really think it's a new paradigm is being introduced in this. And I'm very excited because, you know, we are starting to even do more studies. The National Institute of Health is supporting the studies in this. And we are starting to do a better science in this area, you know, which is very exciting. And I can tell you, with the probiotic which we developed, Biohm probiotic. When people come to me and they say, oh, I feel much better, whatever, it excites you. You feel, wow, this is really good. And I tell you, if we even show that 30% of all the science that's been done in this area come through, we are gonna be in a much better position health-wise, and hopefully we'll have more preventative measures than the disease. So it's exciting time to be part of.
Yeah, it definitely sounds like it. Well, thank you for talking with us, and then thank you everyone for watching.